Legal and medical disclaimer. This is not medical or legal advice and is only my opinion. Please refer to the full disclaimer at the end of this video or on my video description. Holly said to me, I actually threatened the hospital and told them the deep they were in. 2 days later, they held a child protection meeting 10 days after filling in a child disability form. I wasn't reacting the way they thought I should, and I wasn't treated very well. But before, when I was expressing my feelings, I was told I was over-emotional, so I couldn't get the right balance.
I'm going to be looking today at the types of risks that parents face, the risks they face in terms of perhaps getting a false allegation of Munchausen Syndrome by proxy. That parents are blissfully unaware that they may be under surveillance by the medical profession or child protection. They are unaware that their circumstances may place them at risk, and later on I will have a look at trying to quantify these types of risks. This particular video is going to be talking about surveillance. Now you're going to have to bear with me a bit, so I apologise in a way because I want to talk about some concepts to do with power and knowledge, because these are the reasons that mothers find themselves in difficult situations, which place certain mothers at risk of a false allegation of Munchausen by proxy. Foucault spoke about the concept of the panopticon. Now, the panopticon was actually a prison which was designed by Jeremy Bentham in the 18th century, but it was an unusual design of prison. In this prison, the guard was in the middle, and then you had like spokes of a wheel where the prisoners were kept at the end. There were cells around at the end of each of those spokes. So what happened was that the guard could see all of the prisoners, but the guard would shine a light, so the prisoners couldn't see the guard. And what this meant was the prisoners had to assume all of the time that the guard was there, whether or not the guard was there or not. So in this sense, they started to regulate their own behaviour. They engaged in what Foucault referred to as self-surveillance. And in the same way, mothers, when they find that they have been accused of Munchausen by proxy, or even if they worry about it, they place themselves under self-surveillance. They worry, what if this behaviour is interpreted this way? What happens if I take the child to the doctor now? What if I take the child to the hospital? Should I get another opinion? There's a lot of self-surveillance that goes on, and Foucault refers to this kind of invisible self-surveillance as biopower. Mothers are placed under surveillance by doctors, by nurses, by their local doctors, child protection workers, social workers, teachers and lawyers. And this is a major surveillance network. One aspect of surveillance that I want to talk about briefly here is covert video surveillance. Now, this is different to the kind of surveillance spoken about in the panopticon. And that means that with the panopticon, the prisoners know that they are under surveillance. But very often with mothers with Munchausen by proxy allegations, it's an invisible surveillance. The mothers are often unaware that they are under surveillance. So, for example, a specific example of this is covert video surveillance in hospitals. Now, Foucault talks about the clinical gaze and how the clinical gaze developed alongside hospitals, where this meant that doctors had the power to judge and place people under their clinical gaze. So you could argue that covert video surveillance is an extreme form of that. Now, I'm going to be a little bit radical here, and I'm going to say that whilst some people object to the notion of covert video surveillance, my feeling is this: if we really think that a mother might be poisoning or suffocating her child, I don't actually have a problem with a mother being put under covert video surveillance. Now, I know a lot of the mothers are placed under surveillance in this way. For example, I often ask parents, will you moved into a different room? If you're moved into a different room, it often means you've been moved into the covert video surveillance room. Now, there are problems, however, with the covert video surveillance. The first one is that in most cases, the covert video surveillance shows that the mothers aren't doing anything. But if you try to get that covert video surveillance under subpoena to use in a court case, it's often very hard to get, and there will be arguments made about why this should not be put into evidence. Because you see, usually it shows that the mothers are not doing anything at all. The other issue is the quality of the covert video surveillance. So, over 20 years ago, the quality was really, really poor. For example, sometimes it was in black and white, sometimes it was totally blurry, and you couldn't even really work out what was actually on the video. So there were major reasons where this could be misinterpreted. For example, a mother might be breastfeeding her child, but that could be interpreted as suffocation. So we have to be aware of those things, but I can understand if doctors are worried why they might want to engage in covert video surveillance. Foucault also talks about docile bodies under institutionalized control, or passive bodies. And certainly mothers in relation to Munchausen syndrome by proxy are accused of not being passive enough. They're accused if they are assertive. So in this way, there's a great deal of institutionalized control. And medicine decides what is normal and what is abnormal. Knowledge is socially constructed. So those with the knowledge and therefore the power determine what is the truth, and their perspectives become the truth, whether or not it's true or not, whether or not it's factual or not. Knowledge is not objective, it is socially constructed. And so the whole theory of Munchausen syndrome by proxy is a socially constructed theory, and very often that theory is put together due to certain social circumstances and perspectives of those in power with the knowledge. What happens is the normal is seen to be a problem. It is problematized, and so you have the doctors determining that, maybe even a normal caring mother is actually not really normal and they're actually deceptive. And then you have the power of the doctor's authoritative narrative versus the less powerful mother's lay narrative. Their whole narrative becomes illegitimate. Parents are driven by what Nietzsche referred to as life-affirming instinct. And this means that parents will go to extraordinary lengths to try and get help for their children. And sometimes this is misinterpreted as being Munchausen by proxy behaviour. Ultimately, there is this sense of a boomerang risk. Mothers feel that they are at risk from doctors in the hospital situation particularly, and doctors think that mothers are a risk, that they are a risk of Munchausen by proxy. This all happens in the context of surveillance, a network of surveillance.
Please note, I am not suggesting all hospital specialists are a risk to mothers, but only to underline that the hospital context is a greater risk for parents. Hospitals are hierarchical organisations with authoritative control. They contain child protection units and child abuse paediatricians. Parents should always take their child to the hospital if they are concerned about their child. I'm not suggesting parents should not take their child to hospital, but just raising their awareness of some risks.
I believe there has been an increasing antipathy towards women since feminism. With Munchausen by proxy, because it's only women being accused, they are seen as being different to men. And so these women become the other. And I'm going to talk now, I'm going to list some of the risks. Not only do they see them as a risk, which is often more of a neutral term, they see these mothers as dangerous. I'm now going to list unseen or unknown risks that mothers may face in relation to an allegation of Munchausen syndrome by proxy. Now, each of these, I've actually divided them up thematically, but each of these, or each individual item, I am going to ascribe a risk to that. In other words, I'm going to give it a score between 0 and 10. 10 being the highest risk, 0 being no risk. So of course there are none which are 0 in this risk. With my 25 years of experience dealing with so many families in these cases, and also after having undertaken a survey of parents, I have identified these risks. The first risk for a mother is assertive behaviour. A lot of the medical literature refers to the very important notion of non-compliance by a mother. And very often I think these assertive mothers, are seen as being non-compliant. But not only that, the literature also expects them to be totally passive when interacting with medical professionals. Does this mean that mothers aren't allowed to ask questions? I mean, how can a person possibly be completely passive in an interview or an appointment situation with a medical profession? So let's look at this in a bit more detail. If a mother makes a complaint or is in a position to make a complaint about medical negligence, then they are at high risk. I rate that risk as 10. In fact, anecdotally, I would say that probably about 80% of the cases that come across my desk, the mothers have made a complaint. This is also supported by other literature. Also, the next one is if she asks a lot of questions about a child's medical care or treatment. I rate this as a 7. Just generally being assertive or engaging in debate over treatment, which might actually include a previous diagnosis from a medical practitioner who treats the illness differently. It could include all kinds of debate about what is right for that child. That is a risk of 7. If a mother indicates she's going to seek a second opinion or get multiple opinions, which is regarded as doctor shopping, that risk is a 10. Of course, if a child is removed when a mother is accused of Munchausen syndrome by proxy, this means that the mother can no longer get a second opinion. If a mother indicates that she's going to go interstate or overseas for treatment advice, this is also seen as the mother going to extreme efforts to get medical care for her child. And I would rate this as a risk of 4. But it's pretty obvious, even out there in the general world, that sometimes people do have to go overseas to get treatment. Another one, and this is quite an important one, if a mother has accused a previous partner of sexual, physical, or psychological abuse, they are very often likely to get what I call a tit-for-tat allegation. And this usually happens in the family court situation in relation to custody issues. Now, this is not to say that in that context, that every mother who makes these allegations against an ex-partner is true or accurate, but in the cases of Munchausen syndrome by proxy that I have had a lot to do with, the allegation is not correct. So mothers are either diagnosed as Munchausen syndrome by proxy, or the other one is a personality disorder. The last one under this assertiveness theme is that the father is seen as absent, not at the hospital very often, and where he works and what he does for a job doesn't seem to come into it, and he appears to be passive and acquiescent to his wife. Now, of course, if the mother is the primary carer, then you would think that perhaps the mother would have more to say than the father in hospital appointments. The next group of risks are in relation to medical knowledge. If the mother happens to be a nurse, a medical practitioner, or works in allied health or anything to do with health, then they are gravely at risk of an allegation. I regard this risk as 10. Nearly all of the medical literature refers to the fact that very often these mothers are nurses. In the area of medical knowledge, the other issue is that a mother is seen as being suspicious if she has researched the illness or the symptoms online. And this whole notion of mothers using the internet and online services is increasing in allegations. Of course, it's really normal behaviour for somebody to research an illness if they think that their child may have it, or if they think they have an illness themselves. This is typical and normal behaviour, but it is pathologised. And also the parent might be accused of having too much knowledge, knowing too much detail. So if you are an intelligent mother, or if you are a medical practitioner yourself or a nurse yourself, you are accused about being obsessive, that you have too much information. And very often this is seen as a threat. The reality is that parents, mothers, are motivated to find out about the illnesses which are affecting their children. And in many ways, they are more motivated than the doctor who is treating the child. And they may have a bit more time to be looking and researching about these illnesses. And even more so these days, they can research and find out what is actually going on overseas. Whereas before, a country might be more isolated and you might not have been able to get access to this type of information. Another risk factor is the context of being in the hospital setting. If a mother presents her child to the hospital, this increases her risk of an allegation. If she interacts with specialists in particular, then she is gravely at risk in many situations. In other words, the risk is higher in the hospital context than it may be in the setting of a general practitioner or primary carer. And part of this is because the specialists in the hospital don't actually know the parents and the family very well. And so the general practitioner is far less likely to make a false allegation of Munchausen syndrome by proxy. But if that general practitioner supports the parent, then they are seen as colluding with the parent in the Munchausen syndrome by proxy. It's interesting because these days our medical practitioners very rarely come to our homes like they did in the old days. In the old days, it was common practice for doctors to visit their patients in home. And I'm old enough to remember when our local doctor often used to come to visit us in our home. And in fact, one time, as he was driving up our very steep hill, his car ran out of petrol on his way to see us, and we had to assist him with more petrol so he could go and see his other patients. But the point I'm trying to make here is that families were better known to the doctors in those days. They would go into the homes and they could see whether or not parents were looking after their children well. They knew the family, whereas these days, specialists who know nothing about families, nothing about the families themselves, are much more likely to make an allegation against a mother, a false allegation of Munchausen syndrome by proxy. Also creating a risk is if a mother accepts a hospital invitation to assist in the medical care of a child, that risk would be 6. If a mother unwittingly agrees to what they call the separation test in a hospital, not really understanding what that involves, I rate that risk as 10. In the hospital setting, the child may be separated from the mother, and very often it is argued that the child got better when the mother was removed from the care. But very often, and I'm going to speak about this more in another video, very often there are reasons for this, or it's actually in error. So, for example, in one case, the medical files actually showed that after the child was removed from the mother, the child's really high fevers continued for days as recorded in the medical files, and Child Protection had not referred to these files. Alternatively, when a child is separated, they may change the child's medication or diets, and that can be the reason for the difference. Alternatively, the child can actually get sicker when removed from the mother. For example, in the situation where a child may be put on a gluten diet. And these cases become extremely problematic because there is some denial very often on the part of the authorities to accept what is happening. And in those cases, they may double down on the Munchausen by proxy allegation. Also, a mother is at risk, then that would be a risk of 10. If a mother is alone with the child in hospital and that child is on a drip or a feeding tube of some kind, then this places them at a risk that I would rate as 6. Also, the parent of a child under the age of 6 years old, the risk is about 5. Now, of course, we know that very often when a child is young, their medical problems and difficulties, health issues, are only just starting to be discovered. As they grow older, sometimes they may get better because they can just resolve on their own. However, with some genetic illnesses, it may progress and they may get worse. But also one key issue with this, in terms of the child's age, is that the younger the child is, the less articulate he or she can be in stating that their mother didn't do anything to them. So in fact, in one case, in a criminal case, it was found that when the child grew older, she was able to declare that she was still getting the diarrhea as a teenager, even though she had been separated from her mother. Now, the other group of risks is if a parent or a mother is seen as being anti-establishment or anti-mainstream medicine. This will include visits to alternative health practitioners. So this I would rate as a risk of 5. If a parent refuses a vaccination, this could be seen as a risk, and I would label that risk as 5. This is even if vaccination is not mandatory. Another risk is if mother has used medical marijuana or cannabis oil for a child's epilepsy, that's a risk of 6. If the mother has previously had a marijuana habit, risk of 6. If there is a history of drug abuse, which has since been resolved, then I would rate that risk as 6 also. But I would have to say that in the cases that come to me, this is extremely, extremely rare. In fact, on reflection, I think I've perhaps only had one case where there was some history of drug use in the family, and in fact, the drug use was by the father, not the mother. The other risk is being seen as part of a strange religious group. Now, the next group of interesting risks is if the mother herself or members of her family suffer similar illnesses or other illnesses. Now, I find this really quite extraordinary because it's pretty clear that there are so many genetic variants out there, that there are genetic issues in lots of families which haven't yet been discovered. We don't have, medical knowledge is not finite. We keep on discovering new illnesses, new treatments nearly every day in medicine. So to actually say that this is part of this sort of profile of a mother, that she's sick herself and so are her family members similarly sick, I would suggest that this would probably point to some genetic issues. In particular, the literature refers to the mother as a malingerer, or sometimes the mother may be referred to as having abnormal illness behaviour. Basically, this is, in my view, a form of medical gaslighting, because we know that women's symptoms are trivialised. So, of course, they're not going to believe that she has an illness, particularly if it doesn't have a label. The illness becomes illegitimate. And of course, the mother's narrative doesn't hold any chance of overriding or even competing with powerful medical authorities' narrative. So I would like to say, actually, that I don't even really think, well, I think it's probably rare, but I'm not qualified to actually say that, but I would suggest then that people who are regarded as malingerers or have abnormal illness behaviour, or in the old days used to be referred to as hypochondria, probably are really suffering from a real illness. For example, it's really interesting that Charles Darwin suffered from very bad ill health for many, many years. Stomach cramps, difficulty with working, all kinds of nausea, problems with his bowel. And this was documented. I don't know how he actually completed all of his important work while he was so unwell. But later, it was apparently discovered that he was lactose intolerant. Now, next one sounds a little bit bizarre, but I've actually still seen it in profiles of Munchausen Syndrome by proxy. And that is that if the mother has a pet in the family who has been ill. There was a case in the UK where a mother was accused of Munchausen Syndrome by proxy, and part of the evidence against her was that both of her dogs had turned up dead on her doorstep. Now, the other risk for mothers, which I find quite disturbing, is the diagnosis of postnatal depression or depression itself, an eating disorder, or another psychiatric diagnosis. What really makes me sad about this particular issue is that constantly out there, mothers are being told, go out and get help if you have postnatal depression. Go out and see somebody to get it sorted. But nobody says to these mothers, this could be used later on against you in a Munchausen Syndrome by Proxy allegation. No one says to the mothers, your files can be subpoenaed by courts, from psychologists, from psychiatrists, and this, and I have seen it, the notion particularly of postnatal depression is brought up in relation to Munchausen Syndrome by Proxy allegations. This is sad because it may stop mothers from getting assistance. And certainly all of the time, whilst the mothers I was seeing were in a state of enormous distress, they felt in most instances that they could not trust a psychologist or a psychiatrist to discuss their despair and their trauma. In some cases, they were able to find a supportive psychologist. And while I'm actually on that note, in quite a lot of cases, I'd say probably around 60 to 70% of cases, mothers eventually find a supportive medical practitioner who can find out what is wrong with their child or accepts the mother's judgment and observations. If there has been a previous cot death or another child's death, this may be seen as suspicious, and I think we're all familiar with Meadows' law. 1 child is a tragedy, 2 is suspicious, and 3 is murder. And this Meadows' law has led to mothers being falsely accused of Munchausen syndrome by proxy. The other issue is this. In the past, it was a common occurrence, although still very sad, for children to pass away in infancy. Many families might have had 2 or 3 deaths of infants in the past. But these days, because we are able to keep our children alive so well, any death of a child seems to carry this risk of it being suspicious. Now I'm going to look at the group that I put under media. This media issue is quite contentious because very often, parents are not allowed to speak to the media. This means that in many ways they are silenced. But just looking at specifics, if you post a photograph or text of your child on Facebook, that is seen as trying to get attention, and I would give that a risk of 9. Of course, in those rare circumstances where a mother may actually, for example, fake cancer in her child and shave her hair off or whatever, and then gets a lot of sympathy and, may attract funds because of what she is doing, and that's really harmful to the child, but I would regard that more as fraud in the medical context. And normally it's easy to see it because the child either has cancer or they don't. But generally, any photos or texts of a child on Facebook are seen as the mother trying to get attention for herself, as if she's a child herself. The other one is if that parent engages in fundraising or crowd fundraising, and that is because of what I just previously said about those cases of fraud. Now, the difficulty is that very often it is well-meaning relatives who set up the crowdfunding. In one case, it was the hospital or the school that set up the crowdfunding, not the family. And of course, the interviews with the media about their child's illness, that's really, really frowned upon, even if this is before child protection or the police are involved. It's regarded very poorly if a mother speaks to the media. So if a mother posts on Facebook, it's a risk of 9. If they engage in fundraising, risk of 10. And if they've had previous interviews with the media about their child's illness, then it's a risk of 6. Now, Now I'm going to move on to socioeconomic circumstances. Now I did an international survey many years ago, and one of my findings was that full-time mothers are at the greatest risk of false allegations of Munchausen syndrome by proxy. So that I would give that a risk of 8. And of course, not only are stay-at-home mothers at risk, if a mother is a single parent, they also have a risk of about 8 because they don't have any witnesses or anybody to support them. The next risk is part-time working mothers. So the survey showed that if the parent was working part-time, then they had a lower risk than the mother who was a stay-at-home. I would say the risk for a part-time working mother is 6, although this is increasing because there are now so many allegations. And a full-time working mother, I would say that the risk is 4, but it is still possible. Another risk is where you live. If you live in Northern America, the United Kingdom, Australia, New Zealand, Scandinavia, or Germany, you are gravely at risk of an allegation of Munchausen syndrome by proxy. Strangely, very often parents in Asia or some of the Mediterranean countries or South America are not very often accused of this at all. Why would that be? I would put that risk as 10. If a mother comes from a non-Caucasian cultural background, I would put this risk at 5. Now, I need to clarify here. In fact, I would say, that mothers from non-Caucasian cultural backgrounds are not more at risk than a mother from a Caucasian background, because I have almost equal, or perhaps even actually, I would say perhaps more Caucasian mothers are being accused. The point I want to make about the risk for a mother from a non-Caucasian cultural background is the fact that some of their cultural practices are misunderstood and misinterpreted. So this creates a certain different risk for those mothers, and I would put that risk at 5. Now, the other risk is in Australia, for example, if the mother is Indigenous, and I would put that risk at 9. Another emerging risk that I believe will be coming in the future, if it hasn't already arrived now, is if the mother is the mother of a trans child, and I would put that risk at 7.
Unexpectedly, mothers of higher socioeconomic groups are more at risk, as they are likely to be well educated and ask lots of questions. They may be able to afford specialist treatment and alternative healthcare practitioner support.
The last group that I'm going to address here is foster parents. Foster parents may not realise that they are at risk of a false allegation of Munchausen syndrome by proxy. I have found, and I have been contacted by foster parents who find themselves accused of Munchausen by proxy, but in these cases, the biological mother was a drug addict or an alcoholic, and we don't know, whether they were taking drugs or alcohol during the time of the pregnancy. And of course, some children are born with alcoholic fetal syndrome. But what happens is the foster parents realise that these children have problems, and they try to speak about it, and then they are accused of exaggerating or making it up. The other group of foster parents who will get accused of Munchausen syndrome by proxy is when that foster parent realises that the child that has been placed in their care, probably because of a Munchausen by proxy allegation against the biological mother, when they find and discover that the child is still ill in their care and in some cases gets worse, or they may not have been told the full medical history, or they are encouraged to downplay and to say that the child is getting on very well, then if that foster parent speaks up, they may be accused of Munchausen syndrome by proxy. They may be accused of colluding with the biological mother in the same way as medical practitioners who support mothers accused of Munchausen syndrome by proxy are regarded as colluding with the mother.
All information contained within this video is of a general nature only and is provided for entertainment and general informational purposes. It is not medical advice nor personalized advice of any kind. You should not rely on any information provided in this video. If you need advice, you should seek the appropriate professional's opinion. I am not a medical practitioner nor a legal practitioner and do not have any training in those fields. I have completed doctoral and postdoctoral studies in interdisciplinary social sciences on false and highly questionable allegations of Munchausen syndrome by proxy. The content of this site and any written or video content contained on or linked from it represents only my opinion based on my studies. I do not warrant that it is true or accurate in any way. Any reference to medical information or legal information should not be regarded as medical or legal advice and should not be regarded as a substitute for professional medical or legal advice, respectively. Any medical information should not be regarded as a diagnostic tool and cannot be used to suggest, confirm, contradict, or rule out any medical diagnosis. I have made every effort to provide quality and accurate information in this video, but to the greatest extent permitted by law, do not assume any liability for the accuracy or completeness of this information.